Well, good morning, buenos dias. I'm really happy to be here. Thanks, Madam Vice President, Excellencies, distinguished delegates, colleagues. We are living in uncertain and fragile times. Conflicts are multiplying, humanitarian needs are escalating, and trust in multilateral institutions is weakening. At the same time, international cooperation is being tested, placing the lives of millions, especially those already at the margins, at risk. Among those, most forgotten are persons affected by leprosy or Hansen's disease and their families. Their exclusion is deepening, but this is not only about them. It is also about us, about how we understand and embody cooperation, solidarity, and compassion. It is about whether we are truly committed to the promise of leaving no one behind. The report I presented responds to the erosion of international cooperation in recent years, and especially in the past months. Declining political will, shrinking budgets, and fragmented partnerships are threatening gains made over decades in the field of leprosy. The withdrawal of financial support by key actors, member states, and international donors has already disrupted service delivery and coordination. In this context, rethinking cooperation becomes urgent not only in financial terms, but through ethical and human rights lenses. Even though leprosy remains curable, persons affected continue to experience discrimination, disability, and extreme poverty. While some efforts persist, largely thanks to a few committed partners, the broader international response often ignores leprosy or reduces it to a purely medical issue. We must shift towards a human rights-based model, one rooted in the UN Charter, the Universal Declaration of Human Rights, the 2030 Agenda for Sustainable Development, the Convention on the Rights of Persons with Disabilities, the UN Principles and Guidelines regarding leprosy, and the 2022 Kigali Declaration on Neglected Tropical Diseases. These are not only reference points, but they are also actionable frameworks to demand accountability and guide funding, programming, and legal reform. So let me briefly outline the 6 key challenge areas identified in the report. Number 1, policy and funding. Funding remains heavily focused on case detection and treatment in the case of leprosy, with limited attention to the social determinants of health. Critical sectors, education, housing, livelihood, and are underfunded despite being essential to a rights-based approach. Few donors prioritize gender-inclusive programming or address intersectional challenges such as climate change, disability, conflict, age, and migration. Number 2, health capacity building. Many national health systems still rely on external funding and expertise. While WHO and international organizations support training, leprosy has been removed from many medical curricula at the national level. The closure of specialized hospitals and the retirement of experienced professionals further weakens national capacity. Number 3, knowledge sharing and networks. International initiatives are important, but often lack meaningful participation of persons affected due to linguistic, technological, or financial barriers. South-South cooperation shows promise, but requires stronger support and coordination. Number 4, research and innovation. Investment in leprosy research is disproportionately low compared to other diseases. Innovations like AI for early detection demand both digital infrastructure and ethical safeguards. Persons affected are rarely involved in research, design, or governance, raising serious ethical issues. Number 5, human rights and inclusive development. Many partnerships remain top-down. Despite their lived experiences, persons affected are too often excluded from leadership roles. Nevertheless, organizations led by affected persons are emerging as key actors, though they struggle with political and financial support. Number 6, ethical solidarity and compassion. The COVID-19 pandemic revealed powerful grassroots responses rooted in solidarity, food distribution, care, and digital support. Compassion-based training in the neglected tropical diseases field is showing results in reducing discrimination in healthcare and communities. Yet, disparities in digital infrastructure still prevent equal participation. In the report, I call for strategic and ethical shifts across all sectors. For states, prioritize human rights in all national and international leprosy-related policies. Reaffirm commitment under CRPD, the SDGs, and the principles and guidelines for leprosy and the ICESCR. Guarantee access to medicines and create independent oversight bodies. Ensure affected persons are involved in planning, budgeting, and implementation. For donors and multilateral agencies, restore and expand funding for comprehensive responses, including stigma reduction, legal reform, and social inclusion. Promote intersectional approaches, integrating gender, climate justice, disability rights, and children's rights. Provide direct support to autonomous organizations of affected persons, and strengthen South-South cooperation through concrete long-term commitments. For civil society and affected persons' organizations, amplified collective advocacy to influence decision-making processes. Invest in leadership, knowledge exchange, and digital inclusion. Build strategic alliances with other entities, disability, gender, and health movements, and promote an ethical model of shared responsibility, recognizing the well-being of affected persons as a global priority, not an option. I also sustain in the report that the United Nations and its agencies should ensure that leprosy is explicitly included in global health, disability, gender, and human rights frameworks, preventing its continued marginalization in international policy discussions. The Sustainable Development Goals, particularly Goal 3, Good Health and Well-being, and Goal 10, Reduce Inequalities, should be operationalized to ensure that persons affected by leprosy benefit from development initiatives. The protection of the rights of persons affected by leprosy depends on their action now. Without urgent investment and systemic change, the global community risks failing millions of people who continue to face discrimination, exclusion, and preventable disabilities. Madam Vice President, Excellencies, distinguished delegates, colleagues, this is a critical moment for the leprosy field. Without renewed investment and strategic change, we risk failing communities who have already waited for too long for justice, equity, and recognition. The mandate on leprosy remains the only dedicated mechanism in the UN system focused on this population. Its role is vital, not only to document injustice, but to help build spaces of transformation. As we look ahead, I call on all member states and partners to support the renewal and strengthening of the mandate in 2026. We need sustained political and financial commitment to continue this work. Because this mandate is not about the past. It is about the future we are building together, a future where solidarity is active, where compassion is structured, and where cooperation is rooted in human rights, and where truly no one is left behind. Thank you so much.